Hi, my name is Fiona Chadwick, and I'm a psychotherapist and a counsellor. My approach to therapy is integration. So these various different modalities that I can bring to therapy, but the focus is always on the client. So it will be what will work with that individual client. And I can draw on those on the day to work with them. It's not directive or led in any way, so it's a collaborative feeling between me and the client, and feel that we're both working together for their goals and any changes they want to make in their life. So the first session is usually just a conversation between the two of us with the clients to get a feel for what it's like to go to therapy, but also what it's like to work with me and to see are we the right fit for each other, and we'll be able to work together going forward. And it's a general conversation that does include, important elements like confidentiality and the practicalities of therapy, how often the sessions will take place and that sort of thing. But also there's a little bit of information gathering where I might ask some questions about what's going on for the client, what's going on in their life at the moment, what areas they'd like to make a change in, and basically their reasons for coming to therapy and why at this time they have chosen to come now to work on something. And the main approach I use to therapy is person-centered. So this is where the kind of foundation element of my therapy comes from, that I work with the client using empathy and creating a safe environment where the client feels really comfortable to talk about whatever comes into their head. They're not thinking before they speak, because they can fully relax. And I find this approach works really well because you're working with the client. A little bit of a challenge can be introduced, but at the same time, the client is speaking freely and openly and can be amazed by what they say themselves, because we have built a rapport in the relationship. And I really feel that that is fundamentally in therapy. And when they have that, the client can just speak openly and we can work on what comes up in each session. Because as a therapist, I feel having my own personal therapy is a huge benefit, because you get to sit in the chair that the client sits in. You get to experience what they're experiencing and what it's like to feel vulnerable and to open up and to be able to speak about personal things in your life almost with a stranger, and having to see what it's like to build that relationship, to build trust, and what's important and what goes through your head when you're asked those challenging questions. I think it really, really helps you have empathy for the client, because you've sat there, you've felt that. And I think as a therapist, it's very challenging work. And naturally, what clients bring can challenge yourself and can bring up something that maybe you've forgotten about, or trigger something that you didn't think upset you. And then having a therapist that you can go to and bring that up and sort it, as it happens, it means that then you're fully present when you're with your client. And I think having that experience of personal therapy really supports the client as well as the therapist. So outside of therapy, it is nice to be able to unwind. And I do enjoy reading. I love to read. I think it's a wonderful way to kind of just disconnect. So I am that kind of lazy person, sit on the couch, fire in a book, and just that is the perfect day. As well as that, to try and get out in nature, even though I'm always freezing cold person, but I really force myself to go. I'm always glad that I do. And I really feel that our connection with nature is hugely important, even if it's just a few minutes. Go for a walk, no pressure, just listen to silence, or even just hear the trees or hear birds, and what that kind of automatic, natural mindfulness that you can do when you're out in nature has a huge impact and can just really help to clear the mind. That's certainly something that I find really important. I began my training as a life coach, mainly to kind of build my own self-confidence and to see what it would be like to work one-to-one in that proximity with people and with clients. And I really loved this work. It actually surprised me that I loved it as much as I did. And that gave me kind of the confidence and the belief in myself that I can sit with people and connect with people. And then I decided to do my degree. And then during the years of my degree, I was working in placement. I was really lucky to get a huge, diverse client group. And I was working with elements of anxiety, depression, bereavement, domestic violence, neurodivergence. It was fantastic. I really felt I touched on so many different issues and challenges that people were dealing with. And then this led me on to setting up my own private practice and having the confidence to do that in my own home, my own environment, be confident that I could work with a client and bring them through the challenges of life. I've all through my training and certainly went through my placements, the feedback that I've always got is this sense of calm that I seem to bring to the room, that building rapport and working with one-to-one with people or working with couples, that I seem to be able to make that connection really well. And I always find that that's the foundation. And if there's a good relationship between the client and the therapist, that's what formulates and begins a really good relationship that can bring about the change that the client wants. I've done a lot of work around neurodiversity, so I'm really interested in this area, and I've had clients with autism and ADHD, and really the person-centered approach is important here, because when you have one neurodivergent person, you just have one neurodivergent person who's just like neurotypical people, everybody's different, and being able to change and adapt my way of working to each individual has really helped here. And I find this area really, really interesting. I find this really interesting work and have got really good feedback, because I find that working from a person-centered approach, that I adapt the therapy and the sessions to the client in the moment, and find that I can work directly with them, and they find it quite easy to speak back to me and tell me things they want to change, even from the room to the lighting to sound of my voice, like can really get into what will make it easier for them to sit through therapy and to make progress. This is an area I'm really, really interested in and have done a little bit of extra work on and look forward to doing more on. I believe mental health difficulties are very prevalent, and I think people really do suffer, and there's a lot of pressure comes from the environment that we live in. Social media puts a lot of pressure on our young people. It's kind of focused on, but also on every generation. And within Ireland itself, we have housing crisis, cost of living. This is putting added pressure on people. And, like before, it was kind of people felt they could chat amongst themselves, but it's just not quite pushing it now. But having a professional to go to can sit with and talk about what's really going on for you, how this is affecting you, is hugely beneficial. And I feel that, Ireland is improving slightly. Like if you're unwell, you can go to a doctor. If you need physio, if you break a leg, we have treatment centres. And mental health is beginning to act a little bit more like that people do feel, I think I do need to speak to somebody. Or other people will say to someone, you seem down, I've been to a therapist or someone I can recommend. It's slowly becoming, it's improving. I feel that it does affect and impact everybody. And the more that we can create this environment that when your mental health is unstable or you're feeling a little bit alone, you're a little bit lost, but there is people out there to help. I believe we are all susceptible to mental health difficulties, and that we all need support. And it really should be something that's openly available for us. And that when we feel our mental health is under pressure, that it's just becomes norm to just kind of, I need to go and see my therapist, I need to go speak to my GP and get a referral. But it just becomes, you have that thought and you take action rather than sitting with it and feeling like, gosh, what can I do? Who can I talk to? I can't believe I feel like this. I'm the only person that feels like this. And that it becomes something that's much easier to take action on rather than letting it get worse. The clients that I work with mainly at the moment are individuals and couples. So working with couples, it can be anything from relationship issues to financial difficulties, and sometimes just that loss of connection. And having couples in the room together and working with them both, giving them a chance to speak, and talk about things that maybe they have held on to and has resentment has built, and that communication has just changed or even completely stopped. That working with couples, it can be wonderful to give them that space that's safe and somewhat controlled to speak about what is really troubling them, and to have them both do that in the one room and almost take it in turns and to bring that out can really, really help. So I really enjoy working with couples as well as individuals. If you'd like to have a conversation with me before you book in for a therapy sessions, we can have a 15-minute call where you can ask any questions you might have around what's involved in going to therapy, changes that you want to make in your life, anything that you're concerned about. We can have a conversation before you make your booking, and this conversation is free. And you can ask any questions you like, any concerns you have.